Welcome back to The Natural Doctors. I'm naturopathic Dr. Katie Danello alongside Jennifer Stagg, and today we're talking about something that has fundamentally shifted in our clinic practice over the last couple of years. We are seeing people get sick more frequently and more severely than ever. More cases of COVID, respiratory infections, other, viruses like the stomach bug, right? All of these illnesses that appear to be more frequent and more severe. And this is totally different than what we've seen before. So today we really want to dive into what immune recovery is supposed to look like, because not only are people getting sick more frequently, they're also not recovering as well. We hear that our patients are saying, yeah, I got over that infection, but I never really bounced back. Weeks later, I still just don't feel like myself. I can't exercise, I'm exhausted, so what's going on? And this is a pattern we are constantly seeing. So today we're going to dive into what immune recovery actually looks like. So welcome to our show. Jen, is this something that you are seeing in your practice?
Oh yeah, absolutely. Especially this year, it seems even more pronounced that patients are coming in and they've just had the flu, and then the next thing they have strep throat, or even 2 rounds of flu within months of each other. So yeah, it's looking very different. And then of course we've got norovirus, it's pretty serious virus. Yeah, it's very causing a lot of trouble in our, especially in our area. But yes, so we're seeing these back-to-back viruses, multiple rounds of illness in adults, that usually they're also saying that they usually don't get sick. This is strange for them.
Yes.
These are people that are saying, I don't even usually get sick seasonally, right? And then the other big thing is that whole recovery, that they're seeing a different pattern in how they feel after those viruses, right?
Yeah, it's taking them a long time to recover. So we're going to talk about, what does normal recovery after a viral illness look like? And so typically, whether it is something like the stomach bug, an upper respiratory infection, you're going to be sick for a couple of days, right? And that is your body's normal response to being sick. It's not normal to never be sick, right? Like, we're going to get sick and that's okay. But we should recover within 1, maybe 2 weeks, right? 10 days is what we're typically seeing. If you have a lingering cough, which we, call post-viral cough syndrome, we might see that, up to 10 days, maybe 2 weeks. But what we are now seeing is this fatigue, these coughs, this general just like, oh, I don't feel well, lasting multiple weeks, even months. And so it's definitely not normal at this point.
Right, exactly.
So let's get into why we think this is actually happening. And there's a lot of different reasons, and it depends on the person. But I would say the number one thing that comes to mind for me is nutrient deficiencies before we get sick.
Yep.
So then we get sick and our body needs these nutrients to fight the illness, get our immune system revved up so we can respond to the virus, but then also to recover. And so if we're coming into that illness depleted with these nutrients, we're kind of out of luck.
Right, yeah. So I think, the landscape has changed with how patients, what we call terrain, right? So how well nourished they are, how well they're absorbing all those nutrients, which does affect their immune function. And so absolutely, nutrients are going to be a big issue here. And then other sort of environmental factors are playing in. So we're seeing even climate change. We've talked about that ourselves recently, and how that can impact how viruses even like replicate, and how the body, the actual response to an exposure to a virus. And then we have just sort of this low level sort of inflammatory state, nervous system issues, nervous system dysregulation, I guess we could put it into that category. So you kind of have almost a compromised system, and then you're exposed to all these viruses, and even the viruses are coming, not necessarily, sometimes they're a little ahead of season, they're a little off track when we used to have like breaks in between things and expected times. So now it's acting a little bit differently.
It is.
And then we still keep going back and say, well, why is that?
Right.
Why are people in this condition in the first place? And we've certainly spent a lot of time on our show talking about this.
Yeah.
But if we start to think about like specifically, dig a little bit deeper on what is going on here, it brings us back to COVID.
Yep. And it's interesting because, we went through COVID, we got through the pandemic, and then I remember those first winters where COVID, wasn't a huge issue anymore. We were still seeing it, but we were all kind of like, okay, we know how to handle this.
Once we got through a couple of years, right? And the virus had mutated and, everyone's got a lot of like immune memory and everything, right? Things definitely look different. So what are we talking about then? 2023?
Yes, I would say so.
Yeah.
Yep, exactly. So then that winter, I felt like there were so many other respiratory illnesses, sinus infections, upper respiratory illnesses, lower respiratory illnesses, and they felt like they came back with a vengeance almost. It was like my patients were coming in saying, gosh, like this is almost worse than how I felt with COVID. And this just feels crazy. It's like these viruses were not around during COVID, and now they're back. Like it's their time to shine.
And not how they used to respond when they were exposed to viruses before. So we're talking about adult patients, 30s, 40s, have this, history pre-pandemic, don't really get sick, or if they do, it's just like, that sort of recovery, just like we outlined initially.
Exactly. And then, a lot of us got the vaccine as well. And as we get further and further from the COVID pandemic, we're getting more and more research on how the vaccine has affected our immune system. And it has, negatively it has, whatever your views on the vaccine are or were, we do know that it has changed how our immune system reacts. And so that's something to take into consideration.
Right. And so when we think about the virus and the vaccine, these are sort of what can be categorized as systemic events, immune events, right? So it's not a virus like COVID doesn't just, get into the respiratory tract and you're one and done sort of situation. This is systemic involvement, right? Getting into the gut, it's in the lungs, it's damaging the nervous system, the vascular system. So such a wide, systemic-wide effect. Of course, now this starts to make sense why we're in this predicament now.
Exactly. So we are, even if we don't have COVID, we are still reaping the benefits, right?
Yeah, good times, right?
And so, like you said, COVID really affected our immune system, like systemically, right? Our immune system, for those who don't have a medical training, right? Sometimes we might think, oh, it's just our respiratory system, but our immune system is our entire body and it's going to affect every organ. And so that is also coming into play with why we are having a harder time with recovery.
Yep, absolutely.
Okay, so the other thing that you had mentioned was this low-grade inflammation. We've talked a lot about inflammation on the show, and that's because it affects so many people, right? In previous episodes, we've talked about how inflammation is not necessarily a villain. It is our body signaling to us, hey, something's going on here. Now, we think about inflammation from a medical perspective of sometimes it's like this glaring red flag where it's like, oh, this is a big deal. Something big is going on. But with changes in the immune system, we don't see that. We see this low level inflammation that patients might not even feel. They might not even know they have. A lot of patients do feel inflamed, right? Yeah. But even low levels of inflammation, you might not realize you have. So then you get sick and you're like, why is it taking me so long to recover? And we go back and we're like, oh yeah, like look at what that CRP level was. That was borderline, high inflammation. So that is part of the terrain, the change in the terrain that we're seeing with inflammation.
Right. And that helps us describe what's going on with this sort of recovery phase that's extended, what we used to what's been termed convalescence, right? That's that immune system giving it time to recover, reset, get fully back to homeostasis. And so if we think about that from an inflammation standpoint, we're thinking about, the immune system is activated, it mounts an inflammatory response. And then we used to think that just sort of fizzled out. And actually, we do know now, and we've known for 20 plus years, that this is also when the immune system and inflammation turns off, that inflammation response, that's called resolution phase. And so COVID vaccine has really impacted our ability to really kind of turn off that immune response and to go into that resolution phase. And this is why immune post-viral, post-infection symptoms look different than they used to. So before it was just sort of, if you had an extended post-viral sort of picture, it was more just fatigue mostly.
Right.
And maybe low stamina could come with that, some exertional fatigue for sure. And now what we see more, people are, inflamed in their nervous system. So their brain fog is a common symptom that they'll describe. And then another big one is that achiness, right? You're getting some of these joint symptoms. And these are some of the symptoms that living in Connecticut and practicing here that we know very well from patients who have had, Lyme disease that wasn't treated and it's went on to become like secondary, tertiary Lyme, right? So it's starting to almost mimic that, which is exactly representative of that immune response that is resolution phase, not really getting the cues properly to turn off.
It's so true. I like what you said where it's like, these symptoms are mimicking more severe conditions. Like I used to have patients coming in with severe Lyme or EBV or Epstein-Barr virus for people who don't know that. And these are like some of our sickest patients, exhausted, can't get up off the couch, sleeping for days and days and still feeling tired. And we're seeing that post-viral, syndrome mimicking these. Additionally, mimicking autoimmune conditions, right? With joint pain and rashes and just weird symptoms where you're like, what? How is this happening? So absolutely.
Right. So to summarize, we're sort of in this situation where we're getting exposed to viruses back to back, some, more stronger strains, also mutated viruses that we haven't seen, so we don't have full immunity to. And I'm talking about not necessarily COVID virus. There's a lot of things circulating. Flu, influenza A. Some of these patients are having, negative tests when they go in. It's not flu and it's not strep and it's not COVID. And then they're just saying it's some other virus. This could be things like enteroviruses, adenoviruses. There's a lot of other viruses, right? And those can have more of that sort of profile of fever and aches. But essentially, you've got all these insults coming at you, and you have this baseline of sort of low-grade inflammation and an immune system that is been overstimulated, I guess is another way to think about it too. And it is, described that way in some cases.
So that kind
of depleted too, right? Just like you were saying with the nutrient deficiencies.
The nutrient depletions are a big concern. And we saw this, I feel like the one nice thing that COVID did for our medicine was it did highlight the importance of nutrient repletions. I feel like since the COVID pandemic, I now see primary care providers ordering vitamin Ds, right? Ordering magnesium, ordering B12 and folate at annual exams. And I love that. I'm like, great, yes, this is good. And so, going through the pandemic, we really highlighted, okay, this is real. We need these nutrients. These nutrients are cofactors for our mitochondria, for making energy, our ATP. We've talked about mitochondrial dysfunction on the show before and how vital that is for healing from an illness. So those depletions are really important. So at a baseline, prior to going into cold and flu season, you want to get a vitamin D, your B12, your folate, your red blood cell magnesium, get a zinc level, see what your iodine levels are, right? Get these nutrients tested so that you can be better prepared before you get slammed,
I know.
right? And
Yep.
it's easy to do. It's easy to do.
Yeah.
Okay, great. So why don't we go in and talk a little bit about how the gut is involved here? It's a couple of different layers here. So number one, we know that a lot of these viruses absolutely affect our gut, especially COVID, right? We know that COVID replicates in the gut, it persists in the gut, and we can have gut-related symptoms. Obviously, things like flu and norovirus, where we've got vomiting, diarrhea, of course, we've got stuff going on in the gut there. But what we know, and norovirus is a really good example here, or even something like food poisoning. If you take two people and they could eat the same meal that's been contaminated, one person gets sick, one person doesn't. What's going on there, right?
Right. And so that goes back to terrain theory,
yes,
right?
Exactly.
Yep.
That person who doesn't get sick has a stronger gut, more resilience. So something else that people can do before going into cold and flu season, really all year round, right, is really making sure that their gut health is robust. And there's so many ways that we can do that.
And so we're going to get into a lot of that in our second episode. We probably should have primed that up.
Yeah, exactly.
But in our second episode, we are going to really cover a lot of information about what we're doing clinically that's working, first of all, and we've had so much experience with this. Even pre-pandemic, because we were ended up being the ones that, okay, I've been everywhere else and no one can figure out what to do with me.
Yeah, right?
Exactly. To us. But yeah, I mean, we have lots of options and effective options for patients that are dealing with frequent illness, post-viral fatigue. There's a lot you can do there, which is encouraging, right? You just have to know to actually go and seek that out.
Go and do that.
Yeah, that there are things you can do, and you can have, more an improved immune recovery. And yes, you get exposed to these viruses now, and then you're not getting at least as sick, right? You might have more sort of a day where you're a little oh, my throat hurts. I feel like I might be coming down with something, and then nothing, right?
Yeah. I know when that happens to me, I'm a pretty good judge at this point of okay, I just need more sleep. And that I think goes back to the neuroinflammation that you were talking about, which is another deficit that so many of us experience, which is that change in that terrain of our nervous system, right? We've all experienced that where we've had a really stressful week or couple of weeks at work. You feel like you're coming down with something and then you sleep. This is really common. Medical students often experience this, where it's every Friday or Saturday, they feel like they're coming down with something. At least this was me. And then you sleep it off and you're okay, I'm ready for the next week, because it's that nervous system, that neuroinflammation.
Right. That's been well documented, right? We know there are great studies from college students and they go into their final exam period, and all of a sudden you got these spiking rates of illness that are above and beyond what you're seeing in similar age groups that are not in that setting, right?
Exactly.
At the same time.
And this, again, we've talked about this before, where it's we have a lot of women in our practice, right, who are perimenopausal, have great careers, they work really hard, they're raising families, and they're burning the candle at both ends. And that is a huge contributing factor to being more susceptible to these illnesses and then a harder recovery phase.
Right. So it's kind of we're just layering on the levels, right? So we've got this insult from the pandemic. And then, of course, a lot of people have been experiencing a lot of stress from that. So now you have this sort of impaired sort of terrain, gut health, immune recovery that's all impaired. And then you throw on extra stress on top of that. And I mean, we're seeing this in younger patients. Remember, I was sharing with you about a young person that I know who's gotten into her first year of college, and she's had, the flu twice. She's got mono. She has MRSA. And this was a kid that wasn't sick, right? So this is exactly what's going on, is that kind of perfect storm.
Yeah, exactly. And then, we can spend a couple minutes talking about labs as well. They're really I'm not sending people in for viral testing, right? We're great clinicians, and not just us, but conventional doctors too, like, there are signs to know when it's viral versus bacterial, right? And it's like everybody who gets sick, they're like, oh, it must be bacterial, just give me an antibiotic. It's like, no, like this is definitely more viral.
Yeah.
An antibiotic is not going to work on this. And so where labs can really shine, again, as we've alluded to, is not when you're actively sick and you've already gotten the virus, right? Because at that point, it's like, okay, whether this is COVID or flu, it doesn't matter. The management is similar, but it's the labs leading up to it. So those nutrient deficiencies, do we already have some immune activation? Like, do we have an ANA, right? Which is an initial immune marker. What is that low level inflammation looking like, right? What are those gut markers looking like? So when it comes to labs, that's what you want to do, is like that prep work beforehand.
Right, exactly. So that's why, patients are having this profile, getting sick and taking them longer to recover, and they'll come in and they'll say, again, my primary ran some labs. Typically this is a CBC. Occasionally you might see immunoglobulins, and that's uncommon, but yes, some patients can have immunoglobulin deficiencies, but the bulk of these cases, you're not going to see it on those sort of standard immune system tests. You can look at natural killer cells, like, you can do some assays that you can do through Quest. But again, a lot of times we can intervene, and we've assessed the gut potentially. We have done, nutrient deficiency testing, and we know exactly where to target and support. But, we know a lot of the tools that we don't even often have to start there. A lot of times we know, commonly we need extra nutrients and maybe some immune supportive plant-based products, which we'll talk about in the next episode.
Yeah, exactly. So great. Yep. Good on the labs. Something else we've mentioned a couple times that I want to expand on is what's happening with climate change and how we're seeing differences in these viral illnesses. Lyme is a really, really good example, right? We practice in Connecticut, so we see a lot of Lyme, but Lyme is not just in the Northeast anymore. So that's an important point. You don't have to live in the Northeast to get Lyme.
Right.
And yes, we know that Lyme is not a virus, but it is, one of these pathogens.
We don't need comments. Yeah, we do know that. That's bacterial. We got it. We're just talking about bioburdens.
Yes, exactly.
Infections. Yes, but yes.
But because of climate change with warmer temperatures, the ticks aren't dying in the winter. And so we are seeing higher cases of Lyme happening. And like more frequently.
Except this year, maybe.
Oh, well, yes. This is the first winter.
I'm going to be really curious to see what happens this year with the deep freeze for so long.
Yes.
Because we haven't had one for probably 8 years or something.
These are the coldest temperatures we've had.
Meteorologists can check us.
Someone comment on that. But it will be interesting versus last winter when we had very, very mild temperatures.
Right, and you can see active Lyme cases here. You'll have patients that are February, March actually with Lyme disease, right? Acute Lyme disease, which just seems so strange because it used to knock it out. But you're right. So climate change, if we just use that Lyme example, we're looking at bacteria and a vector in the tick. And yes, temperatures can affect that. Also, things that are also playing a role there would be carbon dioxide levels in the environment. That even has an impact on plants. So it's more of, the system-wide ecosystem effects, because we even know this is not an infection, but poison ivy, because of the rising levels of carbon dioxide that has been associated with an increase in the level of the resins in poison ivy that makes it basically like more irritating to the skin. So that people are getting even worse reactions from poison ivy than they ever did.
And I have had some rough cases of poison ivy in my practice where I'm like, oh my gosh, where did that come from?
Right. So that's like the perfect storm too, because you have the poison ivy that's more potent, and then you've got an immune system that's already sort of low level activated, and here we go, right?
Exactly.
But your point about viruses and climate change is really interesting, right? So also, when we get into these extremes of temperature, because this is why you talk about climate change, it's not necessarily just warming trends. You can see extended periods of cold, like what we are in the middle of here now in a lot of parts of the country. And that can actually affect, as we talked about just briefly in the earlier part of the episode, that can affect how viruses actually replicate in the body, right?
Yeah, exactly. So changes in humidity, changes in temperatures naturally reduce our defenses against these viruses. And so we're not able to mount as robust of a response because the virus is replicating so much more quickly, more robustly. So yeah, it's a great reminder that we are all connected, right? We are connected to our earth, our plants, like everything. It's all connected, right? What changes one thing changes everything else. And this is just one example of
Right.
that.
Yeah. So we're a product of this ecosystem. So, right. We don't want to, can't just separate it all out, but
exactly.
it helps us better understand what's going on here for sure.
It does. It does. So it's an interesting time. We felt really strongly about doing an episode, especially coming out in cold and flu season, because this is something we are truly actively seeing in our practices right now. And something else you said at the beginning of the episode was patients are coming in being like, I really don't get sick. And, when I was first in practice, I used to be like, okay, sure. I'm sure we all say that. But now I'm like, no, this is truly real, and I'm noticing this myself. I was sick 3 times this year already. I could not believe it. I was like, I'm working too much.
Right.
My nervous system needs a break.
Yeah. You're still, you're keeping up your clinic load, and then let's just throw a show on top of that. No problem.
Exactly. Anything else we want to say? I think we covered it.
I mean, the next episode, we're really going to really get into better understanding that sort of, recovery phase, and that the immune system's not necessarily broken, right? It is, we can repair all of that, and we're going to talk about how we go ahead and support those pathways and get people out of that sort of chronic inflammatory state.
Yeah, exactly. So if this episode resonated with you, make sure you subscribe to our YouTube channel so that you never miss an episode, especially because our next episode is all about what can we do to improve our immune system. Thanks for watching.